Hey everybody, welcome into the final Caregiver Conversation by Carallel for 2024. Matt Perrin, Director of Caregiver Engagement, back with you, and I'm joined by Sheila Schultz. Hopefully she's a familiar face by now. Hey Sheila.
Hey Matt, how are you today?
I'm great. I'm great. Thank you. Thank you. And certainly happy holidays to everyone. I guess overarching thought that is always on my mind at this time of year, but I know that when we're caregiving, it doesn't, holidays don't always feel like holidays. And um, whatever peace or joy or whatever is good for you right now in your life, we certainly hope you find a little bit of a slice of it here during this holiday season. So, but wanted to start there. And in the meantime, we're going to talk about making the most out of our, getting the most out of our health plan while we're caregiving. So, um, not on the surface, maybe the most exciting topic, but a really, really important one. Um, so today, what that means is we're really going to be focusing on some basics of working with the health insurance company, some benefits. This is a really important part, and we'll touch on some common challenges as well. So, how's that sound to you, Sheila?
Sounds great.
All right, all right. Actually, a little bit of housekeeping. I'm all frazzled here in the last session of the year. But if you are joining one of these sessions for the first time, thank you. We're Carallel. We work every day to make caregiving easier for people all over the country. We are a benefit offered by employers and health plans and health systems across the country. We help with one-on-one personalized support with our team of care advocates, of which Sheila is a part, and we complement that one-on-one human support with our digital experience, which is the Carallel app. We call it Carallel Companion. It's like having Sheila in your pocket, basically. Tons of great information there, lots of practical tools to help you get stuff done. But certainly check that out if you have access. And if you're not sure whether or not you have access, ask your employer or ask your health plan. So, okay, now that we got that out of the way, Sheila, what you have an opening thought on sort of getting the most out of our health plan while we're caregiving?
I think my opening thought is it's not something that any of us just love to dive right into. But so I would recommend as you start thinking about this to carve out some time just to give it a little bit of your effort and be curious about what's inside your health plan that you might not know about, because there's probably more than you know.
Uh, I couldn't agree more. So, and somewhat similar, my opening thought is we talk a lot working with caregivers every day, Sheila, about this something called a circle of care, right? And circle of care is really it's a network of people, family, friends, service providers, faith organizations. Just a network of people and organizations that can help you care for the person that you love. Because really, although lots of us are thrust into this situation and put in a position where it's all on our shoulders. No one should have to do this alone. And when it comes to finding people or organizations that can help, every little bit counts. And the health plan is, a sometimes overlooked contributor to that circle of care, right? There are a bunch of different ways that they can they can lighten your load as a family caregiver. So let's jump into some basics, Sheila, because if I'm being totally honest, if I had the truth serum, and I got frustrated a lot, particularly at the beginning when I was trying to talk on my mom's behalf with her health insurance company, right? And I in my head I was her son. They should talk to me, right? Like, like
Yeah.
that's it. And why can't that just be the way, right? And like, why do I need the member ID number? Why can't you look up the name? Stuff like that. So let's talk about some basics that will save you some potential frustration. And maybe this is obvious, maybe it's not, but it's important nonetheless. First one's the health, the card, right? The actual
Mhm.
card itself. Why is that little card so important for us to have our hands on as caregivers?
Well, there's so much information on that card, and just take a few moments to pull out that card and see what's on there. It's going to have the obvious. It's going to have a name and a member ID and a plan type and maybe a plan number. If it's part of your employer group, it might have a group number. Um, but it also has important payment information, your co-pays, a lot of information about how the system is going to work and what your obligations are financially. And of course, there's going to be contact information on the back. So just to get a sort of an overall sense, take a look at that card and review it so that you're familiar with what's on your loved one's card.
Love it, love it. Yep. And these are like we're all familiar with insurance card.
Yeah.
But when you're in like so much else in caregiving, when you're in the midst of it, when you're in the weeds and you have a million things to do for the person you're caring for your own family or work or there's a million things going on. It's just um back in my, it was easy for me to just like, well, no, like I know all that, but I just want to tell you who I am and why I'm calling and what I need. Um, it, it doesn't work like that. So at a certain point, I wish it was sooner, but I made a copy of my mom's card and kept it in my wallet. Um, but just okay, that's enough on the insurance card, but it is important. Something also that's very, very important is having an insurance authorization form filled out, signed, and on file for your loved one's health insurance. What are these forms, Sheila? Um, Maybe obvious. They authorize us to speak with the health plan on behalf of our loved one. But where can someone find them or stuff like that? Like, how can
Yeah.
they get it done in with as little friction as possible?
I think it's something that a lot of us overlook. You get your health plan, you figure, oh, I've got my card and then I'm all set. Well, it's really important that someone can speak on your behalf if you ever need that. So that comes directly from the health insurance company. You can go into their website, their portal. You can make a phone call and make sure that you find out where they keep theirs. And what it is basically an authorization form saying, I, as the member of this health insurance company, authorize whoever to speak on my behalf. You sign it, and typically it has to be mailed back in. It takes 2 to 3 weeks for them to go through the process, and then you can call back and say, is it on file? And it is one thing that I would really recommend being persistent about. Call back, and if they say not yet, try a week later. And you just rest assured you'll know that you can have the authority to speak on your loved one's behalf once that's done. And then you don't have to think about it again.
Yeah, so this is so what you're saying, I agree 100%, but what that means what would have meant to me as a caregiver is it would have lopped off the bulk of that frustration I was feeling when I was just describing a minute ago when I would call because they call or you call and they see you in the system and there's no friction there.
Mhm.
To me, if I strip everything else away, that's the beauty of having that on file. Um, for in your caregiving situation.
Yep.
And you mentioned member portals, Sheila. So this is just another plug for those, really. And I had a I was reminded of this last week. I myself had a medical procedure, and this isn't a caregiving context, but I was, going through like the pre-authorization for that procedure, and I there were a couple of issues, so I wanted to like make sure, I wanted to know that before I went and had this procedure, that it was authorized and I didn't have anything to worry about there. So I had never logged into my own health insurance portal. Um, Shame on me, but it made I got such a little nice little bump of peace of mind. I was looking at it right on the screen. Yes, took me a minute. I had to find certain things to get logged in, but it was so worth it. And I've been in there like 2 or 3 times since. So just, and if you sort of parlay that into, a caregiving situation that, many people in the audience today would be in, like that would be really nice to be able to just log into something and see the information I'm looking for. So and totally get different people, different strokes for different folks, people that have different appetites for technology and the web. But there is, for us as caregivers, if we do have an appetite to have another website to log into, like there's value that these portals can add to you for sure as a caregiver. Do you agree or disagree,
Yeah,
Sheila?
yeah, absolutely. And I think once again, you have to go in with a good frame of mind when you're getting in there. You see, just kind of you had to dig around a little bit and look for things. Don't go on the spur of the moment when you need the information right then, because you're going to be really frustrated.
Yeah,
Take
I
the
did that.
time, get a cup of tea, get a cup of coffee, sit down, go, okay, I'm going to spend 10 minutes looking around, seeing what's in there. Say, oh, I didn't realize that's how it works. Now I know, so I don't have to go digging in right, when I'm about to take my loved one to a doctor's appointment or get ready for a procedure. So patience is big here, patience.
Yes, yes. Patience and a little bit of foresight to do it at a time when you're not stressed or crunched for time, stuff like that. So it's a great point. I'm really glad you mentioned it, Sheila. Okay, so now let's get into the good stuff. Not the basics are good too, don't get me wrong, but well, and actually before I do that, these are conversations by design. So if you have questions or perspectives to share, tips that have worked for you, by all means, please do share them in the chat. But so the benefits, as I was mentioning at the top, this concept of circle of care, this it's essentially, I think of it as my safety net as a caregiver, right? Because I can't do it all. There are people, family, friends to who can fill gaps, organizations, service providers, like just people that can help, right? And I would not, when I was starting out as a caregiver, have thought about my mom's insurance plan. Um, Having a role to play there. But
Yep.
boy, was I wrong. So, Sheila, what are some of the benefits that, and obviously every plan's different, different plans offer different things and all of that, of course, but some of the common benefits that you might find in, say, a Medicare Advantage plan. Um,
Yeah.
you know,
This is
what,
something that people are amazed that they have some of the supplemental benefits.
yeah,
Things like ride services, transportation, to medical appointments, sometimes ride services to run errands or companion care, in-home non-medical care, certain hours per year that they offer. So many different kinds of services that you don't necessarily think about. Safety. Sometimes they offer things like the little devices that you wear to notify someone in an emergency. We call them personal emergency response systems. Sometimes they're free of charge through your health plan. And by just spending a little bit of time in that portal or website or calling member services and finding out about benefits, you can really dig into some things that you didn't know you had.
yeah, yeah, and so the transportation alone would have been huge for me, as the first 3.5 years plus of my caregiving experience, I was doing it remotely. I'm in New Hampshire, my mom was in Massachusetts, and from afar, and obviously I was going back and forth quite a bit, but from afar I was stitching together, you know, her her circle, so to speak. And um, having a transportation benefit like that would have been very, very meaningful, and even stuff like groceries, right? There are
Yeah.
benefits for grocery delivery or meal delivery at certain times, which again would have been very, very, very helpful. So, lots of stuff, and you just have to check with your plan. I mean, fitness, right? If when we think about home safety as an example, like yes, personal emergency response system, getting that for free from a plan would be great. But, then there's a lot that goes into keeping someone safe at home, right? There's the response and monitoring, but there's also like the home itself. There's also your loved one. Like, how's their balance? How, like, are there things they could be doing, like a fitness plan? couldn't really help with that. Things like silver sneakers is what's in my head, stuff like that. So there's lots
Right.
of different benefits, and it comes down to, um, as you said, I'm not sure if you used this exact word, Sheila, but just being curious and
Mhm.
maybe a little proactive and making that call to the insurance plan to just understand what your loved one has access to, or making that call to a care advocate. We do a lot of this with, for those in the audience who have access to the Carallel service, we do a lot of this, just helping people find benefits, that could help them solve a problem in
Absolutely.
the moment, right? So. Um, Anything else that people should know on the benefits? I mean, are there questions people should be asking? Um, is it just like calling and saying, "Hey, give me the menu," or
Well, you can
uh,
do that, but I think we've given you some ideas. Some of the other things that I thought of, you think of meal delivery and you think, oh, I don't need meal delivery because everything's fine for right now. But sometimes they offer for like a 2-week period after a hospitalization. So when you're recovering and you can't and you're not able to make meals on your own, those meals are provided for you, which is so helpful when you're trying to heal and you can't do everything during the day, helping your loved one get the proper nutrition. So, and I love that you brought up the fitness because it also really adds to socialization, prevents isolation and loneliness. So there's so many different side effects to some of these benefits that you don't necessarily think of.
yeah, yeah. Another one that I just thought of that is common too is, I don't really know what to call them, but like over-the-counter discount programs.
Hmm.
A lot of plans will offer those where, in our session last month, we were talking about, uh, or was it 2 months ago? They all blend together, but we were talking about reducing caregiving expenses, right? Like expenses is a broad category, but the everyday expenses, that add up, there are, oftentimes in plans they'll have these discount programs where you can get a break on the items you're buying regardless, right? So there's all sorts of good stuff there, and I I had a kick myself moment, after my mom passed away. So my caregiving was over, um, and I found out about the transportation benefit in her particular plan that I wasn't aware of it. Um,
Oh
and
man.
and that was one of the things. I was forever finding her rides, among other things. But it was just so, can't stress enough, make the call, whether that's to, the plan itself, care advocate, what have you. Uh, so, and then I guess one other thing in benefit, it's not necessarily a supplemental benefit, but just, um, I think it's an important thing for us to touch on, which is, how these companies are structured, right? Like when you're calling, where are you calling, or who you're working with, right? So obviously there's member services, um, but, are there other groups that you could tap into based
Sure.
on, the, let's say, for example, the complexity of your loved one's situation? Um,
Yeah. Yeah. Sometimes they have, sometimes you're assigned a case manager or a care manager, and it could be dependent on just the plan you have. But it could also be dependent on conditions that you have, either heart
mhm,
conditions or diabetes or something like that. They assign care managers. And that is something, a really great resource because they help to coordinate the care within the system. So it's always good to ask if you have a case manager or a care manager. They could be invaluable.
okay. Um, and on that note, so asking obviously, but I guess something else, and we talk about this a lot in other contexts. For example, when we talk about, well, like for instance, next month the session will be on being an advocate around hospital discharge, right? So entirely different topic, but we talk when we're helping people with discharge. We talk often about, um, urging, strongly recommending, doing whatever we can to get people to be as transparent about their situation as possible.
Mm.
Because if it's not said, they won't know, right? So I think some of that applies here as well when you're talking with the insurance company. Not that that will be any sort of like magic wand, but I think generally speaking, it's an important reminder that people don't always know the full context of what we're carrying as caregivers,
Right.
and it's important um, to be as clear as you can. And you might feel like you're a broken record when you're saying it, but keep saying it, I guess, is
Hmm.
another piece of well, another reminder
Yeah,
another thing to keep in mind as you think, hopefully start to think about the insurance company as sort of part of the circle of care, because that's really what it can be in a variety of different ways. So
absolutely.
good. Um, okay, so I'm looking at the clock, 7 minutes, and let's talk about some common challenges. And um, I alluded to a couple, which are sort of everyday challenges initially, in terms of that were really a function of me not having the basics sort of in place, which made it challenging. Like, let's talk about some of the bigger ones, right? Like coverage denials, as an example. Um, these things do happen at times. So,
Yeah.
um, what do we do if uh, if if we experience a denial?
It's something that I talk about with caregivers all the time. And they say, well, I can't do anything because this was denied. And I said, oh, yes, you can do something. And there's an appeal process. And if you knew what the issue was, you'd be surprised. Sometimes it's just a form was filled out incorrectly. And it could be that they actually don't approve of a medical procedure or treatment, and that's possible. But the thing to know is there are always ways to keep going, keep persisting, appeal the process. And you can start by looking at your plan, your policy, and see what's allowed and what's not. You can actually call the benefits department and talk that through. And then you really want to connect with the medical provider, doctors, and say, look, you said we were going to do this procedure, and now my insurance company is denying it. Help me. So
Hmm.
that's the first couple of steps that I would say.
Yeah. So just to recap, so obviously, and not to get too obvious here, but I think it's important. So you get a denial letter. Um, obviously you'll read it when you get it. It can be obviously frustrating and stressful and all sorts of different emotions, but with a clear head, it's important to review the letter, right, with
Mm-hmm.
fresh eyes. Maybe have someone else review it, someone that you know and trust. Um, Cross-check that with the policy, right? And you can do that in a variety of different ways. If you have the actual policy itself, you could do it in the member portal. You could call, as you alluded to, Sheila, right? And then there is sort of uh, taking action, right? So that's like the first half is what I just described, and the second is actually appealing. And initially, it's what's called an internal appeal, right?
Yep.
So you're appealing to the health insurance company, and each one will have a different process for that. So, um, obviously, um, you'll need to know what that process is, right? And
Mm-hmm.
again, you can have make a phone call and keep persisting, as you say. I love the way you phrase that, but make sure you understand what the process is. To actually take those steps in the process, you'll need to gather information, right? And some of
Mm-hmm.
that could come from the doctor or the medical provider, um, but gather whatever pertinent information you can to
Yeah.
feed that into the appeal, right?
I
And then
think, sorry, I didn't mean to interrupt,
no, that's
but I
good.
do think that something that's important to know that the reason why you want to get the medical team involved is that There's a couple of things that could have gone wrong. Like I said, maybe the doctor's office filled something out wrong, and all they need to do is resubmit the same
Hmm.
claim, but fix the problem on the paperwork. So that's something that's kind of an easier fix. The other thing that doctors can do is write a letter and say, hey, this was medically necessary. Please, take a look at it
Hmm.
again. So there's two
Hmm.
things that the doctor's office can do for you. So it's really important to engage them and get them involved.
Yeah. Um, yeah, so totally agree. And I don't want to lose sight of something you said because I love the words you use, but I also think um, it's actually really important to use them. But when you're talking to the doctor or the medical provider about this, as you're describing, Sheila, I think you said, help me, right? At the end.
Mm,
Like, I
yeah,
feel like those words are important to use
yeah.
when you're doing this, right? And in a way that, um, I don't know, the word choice is important. And I, I, I feel like that is a very, very small, minute detail, but one um, that can be important in these sorts of processes. So, um, and speaking of persisting, right? So, let's say, I guess the other thing is make sure you're cognizant of like in the appeal process for that insurance company, making sure that you're cognizant of what the deadlines are is
Hmm.
very, very important. And maybe it goes without saying, but filing ahead of the deadline or within the deadline period. Um, but then what happens if the appeal comes back and it's still denied, right?
Well,
Keep
then you need to
persisting.
take it, yeah, you need to take it to another level, right? So
Yeah.
you're going to go externally, sort of out of the system. And you can go to your state to look for your commissioner of insurance or whatever that's called, the state insurance regulator sometimes. And they can help you as a third party assess the situation. You could just Google that, put your state in and say Department of Insurance,
External appeal. Yeah.
external appeal, exactly. So
Right.
that's what you're looking
Right.
for.
Okay. So, and then underpinning this, of course, is these things take time, which can certainly add to frustration. So, in parallel to everything we're talking about here, you know, the, it can be helpful to be thinking about other considerations while this is all playing out. So, um, you know, is there other coverage you might be able to find that could help in some way, depending on
Absolutely.
what the situation is? Um, are there temporary solutions? Obviously, if something's appealed and you don't necessarily want to be paying, but that's kind of a loaded topic. So, can you negotiate a payment plan to mitigate your risk there? Things like that. So, um, is there financial assistance available from the provider? Like there are lots of different. Um, Everything should be on the table, I guess, in
Yeah.
terms of these interim considerations while the process is playing out.
Hmm.
Um, so that is the largest common challenge. Sheila, I just noticed does fly when we're having fun. Um, but we are at time. So we've covered the basics, some benefits, and one of the larger elephant in the room type common challenges when it comes to getting the most out of your health plan when you're caregiving. Any final thoughts?
I think just kind of reviewing what we already said, Matt, I think being curious, taking time when you have some time to look through the portal or look at the policy, be patient. So be curious, be patient. It's going to take some time and be persistent.
Love it. I love that. Curiosity and persistence are two caregiver superpowers. So,
Hmm.
it just helps to have a reminder there. Um, I agree. I agree. Hopefully, people found this helpful. We will be back at it again. We'll be publishing our 2025 schedule shortly. We do have the January session all scheduled. It's January 23rd at noon Eastern. We'll be talking, as I mentioned earlier, about advocating during hospital discharge. another important topic. In the meantime, though, just reiterating what I said at the top, whatever joy, rest, peace, whatever good looks like for you right now in your personal situation. I hope you find some of that here in this holiday season. And thank you for being here, and we'll see you in January.
Take good care.